Hey guys, Dr. Casey Schneidler here, and welcome back to Movement Every Day. I hope you had a good 4th of July, hope it was safe and fun, and hopefully you got to spend some time with your friends, family, or even both. Today we're going to do the second video of our video from last time, which was about trigger points. I went over, it was kind of a lengthy video, I understand, but it was just kind of educating you on what trigger points are and just a little bit of information about them. So if you're watching this video and you're not really sure what I'm talking about, go back to the next video and watch it, and we'll kind of bring you up to speed to what we're going to be talking about today. Today I want to show you a very, very common trigger point, or not, that happens in mostly all of us, and I can find it on, or at least find parts of it, or somewhere on practically every patient I treat, is the upper trapezius trigger point. I'm going to be showing some awesome photos here on the right side of me here so you guys can follow along. But your upper trapezius, well, your trapezius muscle is actually comprised of 3 different areas. You have an upper part, a middle part, and a lower part. The upper part of the trapezius I work on a lot just because I'm always working on the neck and the upper back, and it's a very common, easy muscle for me to find, where I can find those little ropey fibers, those knots, those nodules that we talked about in the last video. So today I want to quickly show you that book that I showed you last week, and I can show you kind of some pictures, but I'm also going to throw it up on the screen for you of where common places the trapezius trigger points like to live. So I'm going to grab this here. Remember, this was the, I'm going to come up really close. This was the Trail Guide book, so if you're ever interested in more trigger point work, or you just want to kind of educate yourself, you can get it. But here is that trap muscle, okay? So like I said here, this is your trapezius muscle, and you gotta cut, these X are like common trigger point positions, but the one I'm gonna talk about is the one right here, and it's kind of on the side of the neck, and we can see that they're, very common spot where those taut and tender fibers become, and when you kind of feel them, you can feel those nodules or knots. And a lot of times individuals come into the office with this trigger point, and they're saying, "Doc, I have some headaches. I don't know what's going on." And we can show you that this muscle, if it has a trigger point there, can be referring the pain to the head, to the side. And it's actually the very classic, we call the question mark, the sign, when you have a trigger point right there in the neck, it refers pain. So, a lot of people say, okay, when I touch them it hurts, and it hurts locally, but these trigger points, if they stay there, they can harbor and they could refer pain, which is very important. Sometimes people can come in with some jaw pain, they're like, what's going on? And I can work on a trigger point in the neck, and all of a sudden they start getting that jaw pain. So then we fix the trigger point with some techniques that I'm going to show you, and then it goes all away. So I'm going to actually jump into the other room here, and I'm going to show you a technique with my hands that I can do personally, but I'm going to also show you 2 different ways that you can do something at home in the other room. So let's go right over. Alright, so one of the techniques is using a tennis ball or a lacrosse ball, any kind, or even maybe a baseball, whatever you have laying around. The tennis ball is kind of smart to start off with because it's a little bit softer. But all you're going to do is, wherever you feel those, nodules, wherever you feel those knots or those trigger points, like if I put one right here, I feel a little tenderness here, and I can feel a little bit of ropiness, so I got a little knot right there. What I'll do, and it's right here on my trap, what I'll do here is I'll take that tennis ball and I'll pin it up against the wall. Watching for this hook, I've hit my head a lot on that. In finding that trigger point with that tennis ball, you're going to kind of have to get your body in a position and pin that tennis ball up against the wall. And you're going to roll over that trigger point, and you're just going to find it, and it's going to be tender if you hit it right on the money, and you're just going to kind of hold it there for about 30 seconds or so. You could also move it around, kind of break up that knot, and try to just get some blood flow, some oxygen, some nutrients in that area, loosen up that tissue, and then it usually gets less in pain, and it can go away. And you're just going to roll, and you can do that really anywhere in the muscles up in that back or that upper shoulder area with this tennis ball, but today obviously we're focusing on that upper trapezius. All right, let me grab something right over here. So the next one we're going to do is, this isn't the best example because I'll show a picture to the side here, but I'm going to use a golf club because this is what I had in my trunk, but there are things called hooks out there where you can go to like any sporting goods store and find them in the exercise area, where it just basically looks like a hook. And essentially, I'm going to use this as that hook. And what you do is you're going to kind of put that hook on the back of that muscle, and wherever that knot is, and you're just going to basically pin that up there, and you're going to pull. And you're going to pull tight on that muscle, on that trigger point. And again, this is essentially doing the same thing as the tennis ball. However, you're using just a different tool to do it. And they usually run around 20 bucks or so at your nearest sporting goods store. And I actually really like them because they also have a couple different heads on them. And it's just like, it's literally just a piece of plastic, and it has like a ball at the end with, you know, some other things that you could use for other muscles of the body. But it's essentially, you're hooking on that trigger point, you're holding onto it for about 30 seconds or so, breaking it up, getting those oxygen, getting that nutrients, kind of creating a little inflammation so that tissue can kind of relax, and then hopefully we retrain that tissue doing some simple exercises, working on our posture so that trigger point doesn't come back. I'm going to bring my assistant here, and I'm going to show you one last technique that I like to use on my own patients. So if this stuff doesn't work at home, you could always find someone around you that does this kind of stuff, or you could always come in and I can talk with you and I can see how I can help you as well. So let me bring my assistant in. Hey guys, welcome back. This is my assistant Vianney, and I'm going to show you a technique that I use to work on those trigger points we're talking about. I like to use a technique called pin and stretch, or another term that a lot of people know about, it's called active release technique, or ART. Essentially, what I'm going to be doing with the muscle in the upper trapezius is I'm going to take your head and put it into a shortened position. Take that muscle, put it in the shortest position possible. I'm going to take the pad of my thumb, and I'm going to put it on that problem area, wherever that trigger point is, and then essentially I'm going to take that head from a shortened position and stretch it to a lengthened position. What this does is it does exactly what the other things do. It breaks up any spasm, any hypertonicities, any of those trigger points within the muscle belly. It brings in those oxygen, that blood, that nutrients into the area so we can start to heal the tissue. Then what we do is we retrain the tissue through some exercise, give the patient some adjustments in the area as well if needed, and then usually this stuff goes away. So I'm going to show you what the pin and stretch technique looks like. Okay. I'm going to have you just hold your head up straight for a second. Okay. Now relax your head in your head. So what I'm going to do is I'm going to take the upper trapezius and I'm going to put it in a shortened position. And what that's going to do is I'm going to turn the patient's head away, and I'm going to drop the head down a little bit. And what I'm going to do is I'm going to take that pad of my thumb and put it right on her upper trapezius where that trigger point is. And then all I essentially do is I'm going to lift her head up and towards the opposite side, turn it to the opposite side. So again, I'm in a shortened position. I bring that head up into a lengthened position. One more time. I bring that head down, relax your head, into a shortened position. I pin that muscle with my thumb, and I bring that head up into a lengthened position. I sometimes do this skin on skin, just using my thumb on the patient's neck, or I can sometimes use lotion if it's very, it doesn't feel sometimes great just digging in the skin. So I hope that helps. Like always, like, comment, subscribe. Let me know what you think about the videos. I love getting new feedback, comments about maybe next videos, stuff like that. So until next week, and until our next video, remember, movement's everything, and movement's life.